Hello, nurses, and welcome to the Healthy Nurse Connection. This is a podcast where we talk about all things nursing, whether you're a seasoned nurse, a new nurse, a nursing student, or even thinking about becoming a nurse. This is a podcast for you. We talk about nursing, the hardships, the wins, the goals, and how to live your best nursing life. I'm Leslie Catalano, your host, and this is the Healthy Nurse Connection.
Hello, listeners, and welcome back to the Healthy Nurse Connection. I'm your host, Leslie Catalano, and I'm excited to be back this September. I took a break in August, so I don't know if anybody noticed, but I didn't have a show in August. But it was a really busy summer with my kids and my husband, and we decided to take a vacation in August. And so instead of trying to record a show early and get everything done, I just decided to take a little break. But now I am back. I do have a little bit of a cold today, so if I'm a little bit nasally, I'm sorry, but bear with me. But I wanted to get this show recorded. So let's go ahead and get started. Today, I just wanted to do a short show and talk about the Commission for Nurse Reimbursement. Right now, there is a movement kind of going on through the field of nursing, and if you didn't know about it or haven't heard about it, I wanted to bring it to your attention because I feel like it is very important. What the Commission for Nurse Reimbursement is, so it was founded by Rebecca Love and Sharon Pierce in 2023. So it is a new organization that is focused on looking at how to change the pay reimbursement model for nurses. So if you don't know how nurses get paid, it started like in the 1930s when hospitals started to expand their services and they realized that they needed more nurses in the hospital to care for patients. Because before that, nurses were actually hired by families in a private practice. They weren't employees of the hospital. They had their own practices, just like a physician has their own practices. And families would hire them. So after somebody would go to a doctor and they would give them a treatment plan and medications if they needed nursing care to help get them better. So wound care, medication administration, nutrition, getting them up and moving them, all those nursing care things that we do. The families would actually hire the nurses to either come into the hospital to help care for that patient or to care for that patient at home. And so we were separate from the hospital. But then in the 1930s, when care expanded in the hospital setting, the hospitals realized that they wanted more nursing care within the hospital, but they weren't really sure how to pay for it. So around the same time, the Economic Social Security Act of 1935 was passed, which started the government getting more involved in paying for hospital services. That's how hospitals were able to expand it, because this is kind of where like insurance companies were born and whatnot. And so they were trying to figure out how they wanted to pay for nurses because they wanted them to be in the hospitals more. And so they really took the pay model and they mirrored it off of the hotel industry, where a housekeeper, their salary and their pay is tied into how much you pay for the room, the hotel room. So the housekeeper's pay comes from the hotel room. So hospitals took this model and they did the exact same thing, where the money to pay for the nurses' salaries comes for what patients pay when they pay for a patient's room. So when a patient is admitted to a hospital, their insurance is billed a room rate. So whatever, if it's I don't even know, like $500, $800, $1,000 to be in that room every day. That is paid to the insurance company. So it's not nursing care. We don't get to, like respiratory therapy, OT, like occupational therapy assistants. They are billed separately. They're actually like a line, and so they get billed from the insurance separately. We don't have our own line. When you become a nurse practitioner, then you are able to code and bill the insurance separately, but bedside nurses are tied into that room rate. But what that does is that ties the nurses to the financial stability of the hospital. So the hospital gets that money from the room rate, and then from there they disperse the funds among the nurses, amongst supplies, linens, housekeeping, and other items. So nurses are just a portion of the pie out of those funds. So why is this a problem? Well, there is a lot of conversations out there about understaffing and poor staffing, and we have enough nurses out there to work in the field of nursing so that we wouldn't be understaffed, yet we are constantly understaffed. And this isn't really, mandated nurse to patient ratios have been proven to work, or I should say recommended. So recommended would be like 4 to 5 patients for one nurse on a med-surg unit. 2 patients max on a critical care unit for one nurse. Those are recommended patient ratios. And there's a lot of research that has shown that having those set ratios improves the outcomes of patients. Now, when we get into the mandated part, that means that there is a law that requires hospitals to meet those ratios. And if they don't meet those ratios, then they can be fined or put on probation by their state. So there's like a law. So if it's better for the patient, then why don't hospitals staff appropriately? A lot of times they'll say they can't find any nurses, but again, we go back to that argument where there are enough nurses out there. They just don't want to work in these overwhelming and stressful environments. And one way to help with overwhelming, stressful environments is to staff appropriately. But another reason why they don't is because the hospital themselves do not get enough or do not make as much money if we staff appropriately. So if we have a nurse who is taking care of only 5 patients and the hospital is getting a set money from the insurance company based on the room rate of those 5 patients, and then they have a 6th patient come in, the hospital is going to make more money if they give that 6th patient to the nurse who is already there rather than bring in a new nurse to split the team, because now they have to take all that money from the 6 patients and split it among 2 nurses. So that's going to cost them more money. That is an argument on why hospitals won't staff appropriately, because they're going to lose more money. They can't financially handle it, which is probably true. Many hospitals probably can't financially handle it. So then what are we supposed to do? Well, this is where the Commission for Nurse Reimbursement comes in. They're really going back and taking a look at this model and seeing if there is another way that nurses can get paid. Like, what if nurses were able to charge the insurance companies themselves, and so then they are not financially tied to the hospital system. And so the hospital system will no longer lose money if they have more nurses on the units to care for less patients, because it's not tied to the room rate. They're getting paid their own portion through the insurance companies on their own. So this is a big idea. I would say it's a baby idea. They are doing a lot of research though and looking at a lot of models to see which one might work for nurses, and they really could use help. Like, this is a new thing. You can join the Commission for Reimbursement and give a financial donation or monetary donation. They're also doing this. They're not getting paid by any big corporations to do this, so you can volunteer as well to help with this mission. I think it is a very new and exciting mission, and it can totally change the foundation of nursing and the way care is given to people. So I believe it is very exciting. If you want to know more about it, you can go to their website, Commission for Nurse Reimbursement. There you can join the mission by, again, being a member and giving a financial donation, or you can reach out and see if there's a way to volunteer. They are taking in a lot of research and they're looking through a lot of models, and they need help with kind of all of those things. So I would encourage you guys, if not anything, just to look into the Commission for Nurse Reimbursement, see what they're doing. One initiative they had was to make nursing a STEM field. STEM stands for science, technology, engineering, and math occupations. Nursing is a science, but it has not been recognized by the STEM organization. And if we do get that recognition, what it can do is give more money into educating young people about the field of nursing and getting more young people involved in the field of nursing to help grow. We need more nurses, so we need to be able to go out there and inspire a new generation of nurses to go into the field of nursing. So there are just a lot of things that they're really working on to improve and push forward the field of nursing. So I highly encourage you, if you don't know about the Commission for Nurse Reimbursement, to go out and look them up. If you're able to join their cause or just volunteer, if you have time, it does not always have to be money. If you have time to volunteer and help out, I think they would really appreciate that. So that is what I wanted to talk about today. I do believe that this is a really exciting organization, and this is a cause that is going to help change our nurse environments for the better. Again, this is all research right now. There's no solid idea of where we can go with this, but I think it's really exciting if you can be involved in it, to get involved. If you have any questions, you can always reach out to me about it. I'm always happy to answer any questions. And you can look for my information in the show notes. You can also find the link to the Commission for Nurse Reimbursement in the show notes. And other than that, I hope you guys have a wonderful day. Thank you.